the maracas, I go chick, chicky, boom, chick, chicky, boom.
Welcome to No Laughing Matter with Cuba Pete, a show that takes a critical look at the disparities between medical school education and society's growing healthcare inequities. Join Dr. Pedro Cuba Pete Greer each episode as he interviews the experts working to transform medical education and ensuring that future doctors are trained to provide equitable and compassionate healthcare for all communities. Dr. Greer received the Presidential Medal of Freedom in 2009, honoring his dedication to providing health care to underserved populations. As Dean of Roseman University College of Medicine in Las Vegas, Dr. Greer is committed to creating a medical school of the future where students embrace the need to unite the heart and science of healthcare. And now, the host of No Laughing Matter with Cuba Pete, Dr. Pedro Cuba Pete Greer.
Good day, everybody. I'm Joe Greer, Pedro Jose Greer, and they call me Joe. And welcome to Cuba Pete, No Laughing Matter. I have the distinct honor and pride of presenting not just the co-founder of the entire university. She is the president of the university. And what I can say with great pride, she's my boss. I work for her. And we're trying to emulate here at the medical school, which, by the way, our first class is in about 60 days. July 21st, to maintain what she has created in this environment. Let me just put it out very, very clearly. Having been in academia for all the years that I have been in, academia can be one of the most toxic environments I have ever worked in. Roseman is a flourishing environment, an environment where people work together. People here are for one reason they are here, to educate students in the health sciences. And she has created this culture and done that. And with that, Renee, first of all, I want to start off with, tell me the whole story.
So it was very interesting. So Harry Rosenberg, one of the other co-founders, and I were in a university in California. Our background is pharmacy and pharmacy education. And so we were part of the pharmacy school there. And at the time, Las Vegas was really booming. This is like 1998, 1999. There wasn't a pharmacy school in the state. And so we were embarking on a project to expand the pharmacy program in that California school to Las Vegas. Did a lot of the background work, a lot of the legwork to make sure that we had the appropriate training sites for students, that there was a good base of students that would want to come. All of those were like green light all the way. But the institution that we were at decided that they were going to take on a different program and located in California, and that they couldn't do both. They couldn't expand to Nevada and do this program in California at the same time. And so Harry and I sort of looked at one another and we said, this is crazy. Everything's green lights to start a pharmacy program here. Let's do it on our own. And so he put in $5,000, I put in $5,000, and our other co-founder, Chuck Lacey, put in $5,000. And so with our big bankroll of $15,000, we quit our jobs. We moved to Las Vegas. So this is the summer of 1999. We found some small office space to rent. I got my pharmacy license so that Harry and I would have something to live on. And so I was working in a pharmacy enough to get health insurance, so 32 hours a week. And then the remainder of my time and all of Harry's time was devoted to getting this pharmacy program off the ground. The space that we rented, we did so somewhat deliberately in that it was the home of the Painters Union Hall over in Henderson. And the fortuitous part about that was we had office space, number one, but number two, there were classrooms in there where they would teach the painting apprentices at night. And so these were open during the daytime, and we negotiated with the Painters Union to be able to use, when we had students, to be able to use those classrooms during the day. And they were open to renting to us on a day-to-day basis. So on a monthly basis, we would say we need the classrooms these days, and this is a standard rate, and we would pay them that in addition to the rent that we were paying for the offices. Big success right out of the gate. Our first 36 pharmacy students got started in January of 2001. We immediately turned around somewhat like you're doing with a very truncated admissions process for us was for the second class. Turned right around and recruited the second class that started in September 2001. So we actually had two classes that were somewhat overlapping. Um, but rapidly outgrew the Painters Union building, um, expanded to another site on Eastern, and I used that space for a little while. But it wasn't long before some of our clinical partners, specifically the hospitals, came to us and said, "This is great. We're starting to produce pharmacists for this region. We need them badly, but we also need nurses. And can you start a nursing program?" So we said, "Okay, then let's start a nursing program." And so by that time, we moved to where we're located, our headquarters in Henderson now, on Sunset Way. We located what was an empty warehouse. Again, fortuitous in that empty warehouse, a lot of empty space, so we could retrofit that fairly easy to meet our needs. So this was about a 100,000 square foot building that we retrofitted to provide classroom space, office space, laboratory space. And then, started our pharmacy program, moved over there, started the nursing program over there. And we just sort of grew organically. I think the one thing that I would point to that uh, has helped us in our success is we've had a very clear mission. We didn't aspire to be everything to all people. We knew that uh, there was a current need at that time for healthcare professionals. We knew that that need was going to continue as the population aged, as baby boomers aged and need more medical care. Population was also moving south and west in the United States, and so population was growing here. So this is the right place, right time to really make sure that we were helping to solve the problem of the need for healthcare professionals. And so from there, we added an orthodontics residency program. We started to notice that we were getting a lot of applications from Utah. So we started a second campus in Utah. So we have the distinction of, number one, being the only private not-for-profit higher educational institution that is based in the state of Nevada. Any other not-for-profit or private higher ed that you see here, whether it's Toro or University of Phoenix, is based somewhere else. So we're really proud to say that we are a Nevada institution. We are also the only higher ed institution that has expanded to have a second campus in another state. So we have our Utah campus, started the dental medicine program there, which took off. We were the first dental medicine program in the state of Utah, took off like gangbusters, and is doing really well.
And one of the first in the country to go to a 3-year curriculum
That's right.
with incredibly successful students.
Absolutely. And then, it's always sort of been on that bucket list. And again, it's because of the need, it was to start a medical school. And again, fortune smiled on us with the ability to acquire space in the Summerlin area, which had been part of the Nevada Cancer Institute. We have grown that space over the last 10 years, and that's about how long we've been working on this medical school. So 10 years, and we're then lucky enough to find you to come.
I think it's the other way. We were lucky enough to find Roseman.
And you brought your team with you, very successful, highly qualified team, and just amazing folks to get this medical school off the ground. And so that is in about, maybe 7 minutes, 26 years worth of where we got to Roseman.
And in between all that, you failed to mention that Harry is her husband.
Yep.
And they have a lovely daughter who is studying to become a dentist right now.
At Roseman.
Yep. Maybe we can get her to come in a med school.
Maybe.
A
dual degree.
If she wants to do oral maxillary surgery,
That's right.
bring her over here.
That's right.
And, but that's what we're going to do. We're incredibly excited about starting this medical school. We're equally as excited because we're part of Roseman. We're part of this great family. And maybe here in Vegas, we could start to change for academia all over the country and get rid of the toxic environment. Have an environment where we can actually train professionals that have the virtues and the characters that we expect of citizens to have in this country. And in particularly the professionals. But most importantly, as opposed to any other medical school, it's working together with the other colleges. Nobody should be working in isolation. It has to be a team approach. The doctor has to learn that they're not always the king or the queen. Many times, they're not even close. Whether it's another medical issue, a pharmaceutical issue, or maybe they just can't pay rent or afford the medications. We got to work together. We want to make Vegas the healthiest community in this country. There's another incredible statistic with the graduating students of Roseman. It has one of the smallest default rates in the country for their loans.
It's true.
That's become a popular topic in DC.
Right.
What about the students that over 90% or something like that, 90%, 89% pay back all their loans?
Yeah.
What does that mean? That means they're getting a great education because they're getting great jobs that'll help them pay off their loans. So what Renee has started and continues to do, you see the fruits of that over 25 years. And hopefully with the medical school now, we think Roseman should not be as provincial as it is. We think that Roseman should be known worldwide and nationwide for what you have created, for the culture that you have given us, and for all the programs, whether it's do you know that she started a program years ago that if you are after your third year at NSU, you can actually apply to pharmacy and go directly for your Ph.D. And then she expanded it and did a master's program for the dental school, and we're going to be working with that also with the medical school. So what she has created is just not a professional, but options for professionals to go into, something that a lot of people don't do. And by the way, the nursing school is just not for nursing. They also have graduate nursing. They have family nurse practitioners, and they just started a CRNA program, so which is incredibly needed here too. Renee, what do you see as the future of Roseman?
Well, continue. Our number one mission is to produce the highest quality health professionals that we have, and so that will continue. That's something that's not going to go away. The way that we have grown, and I think why we have been successful is we have had sort of this true North Star of our mission. And that mission is around meeting the healthcare needs of the areas and the regions that we serve. And so the growth that we experience in the future will be around what programs are most needed in the health professions, um, so that we can, as you said earlier, create the healthiest communities for not only us, but the inhabitants of Southern Nevada and Utah to live in. We want to be a contributor to that. We want to make sure that we're helping to alleviate health professional shortages that we see coming forward, but also to do that in a way that's high quality and produces the best graduates that we can.
And also, you could even measure by health outcomes. If you look at the health outcomes prior to Roseman with its pharmacy school and afterwards, there's a huge difference. And that's as the population is growing. So Roseman is here not just to educate, but through education also improve the health of this entire
Absolutely.
state and Utah. We see that with the dental students when they work with Medicare and where they do different programs, the dental programs, the orthodontics program here, when we have days that we take care of children for free. They do that in Utah also. The medical school with its Empowered program. We're now all over the state of Nevada and in Utah. And this is a program designed and run by and started by Andrea Peterson, a graduate of Roseman in the School of Pharmacy, when she was working in the neonatal ICU at Dignity. And she would see these children that were going through withdrawals. So Empowered is for opioid and stimulant use disorder, pregnant women, and recent mothers. And we take care of them. Why is that important? Well, from an educational perspective, a medical student has to see that addiction is not just a personal issue. It affects the entire family. Number one. Number two, social accountability. They're going to be leaders in our community. And just like Dr. Coffman is doing, what is the problem? How do we resolve it? We have the Genesis program, which is a household centered care. We have the Aspire program. So we are a member of the Roseman family and members of this valley. The most important, the family. And we want to continue with that. And the great thing is, by the way, our medical students are not going to be bothered by football games on Saturday because we don't have a football team.
Well, and we have that really clear mission. And I think, one thing that maybe people don't, and I'm glad you brought up all of the different programs that we have. And I think maybe people don't realize, they think of an educational institution, a university, and, it's the classrooms and it's what students are getting taught. But and this was really driven home to me, particularly during the COVID epidemic. But when you have health profession students, there's requirements for them to get experiential training, and so they're out in the community, as you mentioned, with Empowered. Our pharmacy students do health fairs almost every weekend. So do our nursing students. What COVID brought home to me, though, is that we have this army of students that under the right supervision, because they are students, but under supervision, they can be a significant contributor to the overall healthcare of our communities. When we went through COVID, our pharmacy students and our nursing students are all trained to immunize. And so under the supervision of licensed faculty, I don't even remember how many COVID shots we did.
Not only that, you did it at two campuses,
Two campuses.
Anderson and Summerlin.
And the dental students every year do all kinds of free care for patients that are below the poverty line, and provide. Sometimes it's the first time someone has seen a dentist, ever. Do it for children. Also, they have a program where they do that for the refugee population in Utah, which is amazing.
It's an amazing program. And by the way, not only is the dental care excellent that's offered here by our programs, it's probably the most cost-effective in the entire county.
For sure.
So look to Roseman for all your medical needs. We're here. Look to Roseman for the future of this community. Dr. Coffman. And you still have until the end of June to apply to the medical school for the first class. And now we have another class after that. The admissions process is going extremely well. We were surprised. We were very truncated. Generally, we got accredited when all the other medical schools stopped their admissions process. And so instead of having a year, we have 3 months. Now we have a month, and 2 months, and we will have our first class of students. Last Friday, it was quite exciting because after 5 years, we had a first visit for all the students and their parents that want to come here. And and we have students from all over. But what was very interesting was one of the students who comes from actually the Caribbean. And I was all excited because I'm from the Caribbean. And so I was talking to Helen Tempest, the head of Office of Medical Education. And I said, yeah, I'm so excited we're getting a student from there. She goes, Joe, I ran into her at Albertsons in Henderson. She's been here for 5 months. She moved to Vegas. So there, we got a Vegas person coming to school, even though they come from the islands. Renee, it has been, first of all, it's a pleasure and an honor to have you here, number one. Number two, it's a pleasure and a distinct honor for me to be able to work for you. And what happens in Vegas, we're going to make sure the world knows.
Fantastic.
That's our new motto.
Fantastic.
And with that, folks, one of the great leaders of our society, not Vegas, our society, it's called America, one of the great leaders of education, and one of the nicest people I have ever met in my life. That's because she's from the Midwest and all that, but she's an Ohio girl, if I'm not mistaken.
That is correct.
And this is Cuba Pete. No laughing matter. Let's make our community the healthiest community in the country. Thank you.
If you enjoyed today's podcast, please subscribe, like, and comment on your favorite podcast platform. If you'd like to support the groundbreaking work that Dr. Greer is doing at the Roseman University College of Medicine, please donate at the link below. Thanks for tuning in to No Laughing Matter with Cuba Pete, as together we work to unite the heart and science of healthcare to serve all in our communities. See you next time.